All right, guys. I am Scott Fitzpatrick, and I am happy to be here. I'm from Weird Medicine with Dr. Steve, and I was asked to come talk about hacking into the body using different types of herbal medicines and acupuncture and a variety of things. And when I agreed to do this from my new friend James, I started thinking, I wasn't real sure where I was going to go with this, so I started looking back through last year's presenters, and I thought, I wasn't real sure what any of these guys were talking about, so I better just come up with something different. But the bottom line is, I'm glad I'm here. I'm very happy to be here. I've got to tell you, if you haven't listened to our show called Weird Medicine, we're on Sirius XM Radio, and we have these podcasts that we love to do. And Steve is the head honcho, Dr. Steve. He's a palliative care doc. And we were recording a show for Sirius XM the other day, and on Tuesday, actually, and he got very upset that I was invited to come to SkyDogCon, and he wasn't. He said, so where exactly are you going? I said, well, I'm going to Nashville to talk to the SkyDogCon. And he said, well, why didn't they ask me? And I said, well, I think they thought that maybe you were too famous. And he looked at me, he goes, well, I probably couldn't have gone anyway. And I said, well, really, why is that? And he said, well, Saturday I'm taking the kids to Dollywood, and Sunday I'm packing and getting ready to go to Manhattan. So what are you doing in Manhattan? Evidently, Steve has been invited to go to Manhattan and do some breast exams on porn stars. Yeah. And I did not get invited to the porn stars and the breast exams. So I get to come talk to the computer hackers. But we both decided that my talk was probably more important because you guys are the people we don't want to piss off. So anyway, I am from Kingsport. We have a big clinic in East Tennessee, and we do a lot of things. I actually went to a traditional Chinese medical school in Houston, and we were talking about just a little bit ago. Unfortunately we do a lot of chemotherapies and cancer-related things in East Tennessee because of a lot of the chemicals. And so I really wish I would have been here yesterday for the Bowling talk, because I think detoxing the body is huge. And we'll talk about that a little bit today. This is going to be a really, hopefully, flexible, right? That's our magic word, because fluid is we use on our show, but flexible is the magic word here. Really flexible discussion. I'm going to throw some stuff out there. We can talk about it a little bit, and hopefully we can have 100% people awaken this at the end, and as long as nobody falls completely asleep. So I got to tell you, and I was talking to James, and I thought, what am I going to do? What are the things that I like to tell people before they leave me? And I do a lot of conferences all over, which I truly enjoy. I always try to give them a couple things that are vital and that they can take home, and actually that are functional and they can use. And we're going to talk about it in a minute. My mustard story, but when James was and I were talking, I thought, and he actually reminded me of a great story I should tell. When I was in my final year of internship in Houston, actually, we had a female referred into us that had a bad stomach problem. She had like a chronic history of reflux and gastritis. And I, for 3 years or 4 years, had managed to avoid Monday clinic. And because on Monday, we had to do this thing called herb clinic. And Dr. Liu is this little Chinese girl about this big and just mean as a striped snake. And she tortured me because I was one of the very few Caucasians in the whole program. So I avoided this. Get in this final semester of school, I go in, I see this lady, I evaluate her, I go in and see Dr. Liu, and I said, Dr. Liu, this lady has this chronic history of stomach ailments, blah, 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 and here's the formula I picked up. She goes, okay, that is correct. I said, but Dr. Liu, because on Monday clinics, we had to make teas. So literally in our pharmacopoeia, we had everything from dried snakes to sea urchins to rogue way, which is the deer antler of immature deers, for virility, as you can imagine. So I said, but Dr. Liu, we have to make these teas out of these formulas, and I said, this formula has flying squirrel feces in it. Yes. I said, what do you do with flying squirrel feces? I can't put that in a tea. And she looked at me. She goes, it's in the formula. You put it there. I went, but how? And she looked up at me again like I was an idiot. And she goes, you double bag it. So she wanted me to double bag this flying squirrel feces and put it inside of another bag, another tea bag, and give it to this lady. I did that, told her how to take it. She goes home. She does it for 3 days. She makes her tea, comes back to see me a week, and this is honest truth. So I said, ma'am, how are you feeling? You know, I was really kind of concerned. She goes, oh, my God, I started taking that tea. My stomach has not hurt since. I said, that's wonderful news. And she goes, but I'm telling you, that stuff tasted like shit. And that is a true story. I said, well, ma'am, here's the great news. You don't have to take it anymore. So that's, you know, thankfully James was kind of, you know, gave me that little clue. I thought, man, that's a great story. And I have lots of those. We won't get to all of them. But the bottom line is, I'm glad to be here. I'm going to tell you about a few things that I want you to be able to take on with you. You know, the big movement is towards holistic and complementary medicines, not just pills, because in the state of Tennessee, obviously, we have a huge issue with narcotics and opiates and things like that, which is really what I do. I do mostly pain medicine in East Tennessee, and I can tell you, if you want any good, you know, Lortabs, Oxycontins, just come on down, you know, get on I-40 East and keep going trucking. You can get some good stuff down there. But anyway. So we'll get into some magical herbs and uses. Number one, if you don't get anything else from me, anything other than those Simply Herbals I put on the table out there, take a handful of those. They're good for you. They'll make you big and strong and smart and fast and all those things. My Fatigue Reprieve is a substitute for caffeine. It's a substitute for sugar. My Stress Less is a substitute for benzodiazepines. And what we try to do is give people these natural medicines to help them get through the day. So there's a whole table full of them out there. Put some in your bag. Try them. Give them to your friends, as long as they don't have any allergies to them, of course. So if you don't get anything else, turmeric. Turmeric is the my favorite herb. Perfect for it's a perfect anti-inflammatory. It's great for gastritis and arthritis and tendinitis and things like that. Now, you've got to remember, herbs, just because they're natural, they can also be very dangerous. You have to take them, you know, the way they're supposed to be taken. You just can't take them, and just, you know, it's not one of those things. The more you take, the better. That's not the case. But turmeric, if you don't take anything else out of this talk, for gastritis, reflux, GERD, which 99% of the people have in this world, the number one best treatment for it is not. I was going to say Bowen. I haven't learned yet, but I'm going to learn it. But the best treatment I use is mustard, plain yellow mustard. If you have any kind of reflux, take you a little package of mustard, put it in your mouth and swallow it down. And for the most part, that's going to completely alleviate your symptoms. That is absolutely true. I gave a similar talk recently to a group of retired executives from Eastman, and I did that. And I swear to you, I got 2 phone calls the next day from 2 people that tried it. They're like, that's unbelievable, because every night I lay down and my stomach gets inflamed. And it was like a miracle. They couldn't believe it was that simple, but truly yellow mustard. Now, if you don't like yellow mustard, put in a little bit of water, dilute it, or if you don't, just get your turmeric, dried turmeric, and put a little bit in a glass of water, stir it up, and shoot it down. It's wonderful for inflammation, particularly gastritis. And the other thing is that I tell people with stomachs, and we actually have an expert in a GI system in here, thankfully, but the stomach is a muscle. It moves. It likes to move. It doesn't like to be cold. So quit putting cold things in it, because what do cold things do? They make things shrink. You know, if I trip, or if Evan walks down these steps and he trips and falls and hits his knee, the first thing we're going to do is put ice on it, because that restricts blood flow, right? Quit putting ice, cold things into your tummy. No more ice waters, iced teas, cold foods. I tell people it's like Mom used to say, you know, don't go swimming 30 minutes after you eat. Well, the same thing with cold stuff. Don't put cold stuff in before or after you eat. Pretty simple. Now, the exception is, of course, anybody want to guess? Beer. For me, anyway. But what I try to do is balance my cold beer out with hot foods. So, you know, if it's a soup or whatever. But if you don't get anything else from me, like I said, remember, mustard is the key. I don't know what the percentage of like PPIs, the Nexiums and the Prilosec and the things across the population, but for the most part, every senior citizen I've ever seen has taken some sort of a Nexium, Prilosec, whatever. And we could honestly completely throw those in, and for the most part, throw those in the ocean if you would just use yellow mustard and use warm foods and warm drinks. It's wonderful. Ginger. Ginger is a great natural anti-inflammatory. A lot of people don't know how to use it. You chop it up. You can boil it. Pickled ginger is great. We use a lot of this stuff for nausea, for females that are pregnant. Just great all-natural treatment for nausea, okay? For inflammation and arthritis, I think one thing a lot of people don't like is that these tend to take a little bit longer than a narcotic or an NSAID anti-inflammatory to work. And so you have to build these up in your system and get the inflammation out of your system, and you will do better. Rhubarb, a natural colon stimulant. I'll tell you another great story. So I was studying in Houston. My first mistake, as I like to call her, was caused me a lot of stress. Let's put it like this. She had this chronic constipation issue. And I think this is one of the reasons she was now an ex also. But she's like, you know how to make this stuff. Make me something to make me go to the bathroom. So I did. Okay, so I made her a tea, and it didn't work. She's like, is that the strongest thing you have? So the next one, I put a lot of this rhubarb in there. I gave her like a double dose, and she spent the next 24 hours in the bathroom, but she wasn't constipated anymore. So that, was a terrific benefit. But the bottom line is rhubarb is a great colon stimulant. So if you've ever eaten a rhubarb pie, which a lot of us growing up in the South have eaten, and you weren't real sure why the next day you had a lot of, nice flowing bowel movements, that's actually the reason why. Unless, of course, you got some sort of irritable bowel. Astragalus is my absolute number one favorite herb, though. I don't know if many of you guys have heard of astragalus. The Chinese name is Wang Qi. It's just an absolute terrific herb. When I was in school, what I used to do is I used to go in and get this astragalus out. I would tear it, and I'd put it in my mouth and chew on it. It's just a natural stimulant. It truly does. There's actually great research now that's being done showing the effects of the astragalus on the immune function, the islet cells in the pancreas. They're showing people that are type 1 diabetics doing islet transplants. And what they've shown is that people that take these cases that they've shown, the patients that they give the astragalus to prior to the islet cell transplants actually do better, and these people get these islet cells functioning in their pancreas, and I think the ultimate goal is so they won't be diabetic, which would be terrific. Which not to be confused with type 2 diabetes, of course. But even type 2 diabetes with astragalus, I use it a lot just because it helps with the inflammation. It helps with the balance of the body, and it really supports just a good, healthy system. And there's really good scientific research to validate this. Ginseng, we all know ginseng, and I don't know if any of you guys have seen the shows on television that they're doing now. It's like the Mountain Gold or whatever, where they've got the guys in West Virginia that are and I guess North Carolina and probably East Tennessee that are going out in ginseng, and I really wish they wouldn't show that on TV, because now everybody thinks that we all look like that and we all go up in the mountains and hunt ginseng, which it's just amazing. And now I don't know if you guys have seen too on like the Learning Channel, they have this police show. And it's based out of Sullivan County, which is where I live, which is East Tennessee, and they've got these guys chasing around these people cooking meth and taking, all of these crazy pain pills. It's just amazing. But anyway, ginseng is a great energy booster. It gives you very similar effect that caffeine does without the crash. Those herbs that I brought out there, the one called Fatigue Reprieve, The Fatigue Reprieve has ginseng and astragalus both in it. It gives you a nice little sustained energy boost without the crash, and it's wonderful. My whole concept in creating these we have to call them dietary supplements. These dietary supplements was to get people off of the 5-hour energies and the monster drinks and things like that tend to have a little bit, have some side effects. These don't. These herbs don't, as a general rule. Dandelion. I put dandelion in here not because I use it a lot, but I just think it's just amazing. You know, when you look at these lawns and people have these chem lawns and they're spraying these lawns full of chemicals and killing these dandelions, those things actually have lots of minerals in them. Now, I don't go out and eat dandelions out of my yard, but I promise you, you could eat them out of my yard and you wouldn't have any kind of chemical reaction. And again, it's a touchy subject, but we feel pretty confident that a lot of those chemicals we're spraying on our lawns do tend to cause some renal cell carcinomas, and I don't know. And again, I don't have the research to back that up, but that's what we see in our practice. Mucuna. Mucuna is a really interesting herb. Velvet beans, the only natural source of dopamine, and this is really important because there's a doc in Florida, and I actually use his stuff. He's actually got an all-natural substitute for levodopa and carbidopa, two of the most toxic medicines there are in the market today. The mucuna, it's kind of hard to get, it's kind of expensive, but there's no side effects and actually gives dopamine balance. I actually use these for some of my patients with Parkinson's and with tremors, like essential tremors and familial tremors, and it works really, really, really well. So here's a couple cool ones I like. Anyway, Cordyceps is a mushroom found on the heads of Tibetan caterpillars. Strangely enough, they've isolated some of the little components of this Cordyceps, and it does actually help as a digestive support. Now, it's also used as a blood thinner, and thankfully what they've been able to do is they've taken those mushrooms down, and we can actually grow those on tobacco plants, which is terrific. So there really is a great, and I always knew there was a great use for tobacco plants, but that's one thing they're using this for. The serapeptase is a digestive enzyme of silkworms. I use this all the time on my patients. Now, I don't make them go get their own silkworms and squirt them in their mouth because that'd be weird, but the serapeptase is a wonderful, all-natural substitute under under guidance, you know, and working with your physicians, that really works well on blood clots. So I've got a patient right now. She's got this genetic condition where she gets a lot of blood clots in her lungs, and it's a very dangerous thing, not to mention deadly. She's been on this for a couple of years, and it has cut her hospital visits down to, she's been in the hospital, I think, once in the last 4 years, where she was going every year with massive amounts of blood clots. Works great. And all these things you can find. You can find research on these things. You can find most of, and my number one research platform really is PubMed, which is where I look most of my stuff up, because when I speak to Western medicine physicians, I like to have a lot of research-based stuff, and this is where this all came from. Bee venom, some great potential at poking some holes into the outer coating of a virus. And you guys are pretty smart people, and you're poking holes in computer systems. Very similarly, this bee venom goes in, kind of bores a little hole, and then that allows us to treat these people with medicines and also for these viruses to die. And the number one they're using this, the number one virus they're using this on right now and having great results is the HIV or AIDS virus, because that is such a hard, really thick viral coating, and it's almost impossible to crack. It's about like 99% of those locks next door that we were looking at earlier. The great thing is they're starting to find that these natural herbs, natural treatments really truly do great things. Now, stool transplants. Everybody loves a good poop joke. I don't have a great poop joke for stool transplants, but I can promise you one thing. Every time I talk about this, people are like, "Oh God, that sounds awful." I'm like, "Yeah, unless you have C. diff. And then you'll be like, I don't give a shit what you do it." No offense, but that's the truth. Stool transplants, what they're finding is these stool transplants from healthy individuals, you insert these into the patients with the C. diff, and they get better. Now, Crohn's disease, rheumatoid arthritis, a lot of these things are really difficult to treat, and we're using a lot of natural herbs and remedies to treat these things. And one thing I will tell you, not only just giving people these herbs or these medicines, prescription medicines to help people, but taking them off of things that cause the inflammation. And I think a lot of us who do this type of thing would say that you may not know you're allergic to something or sensitive to something, but you probably are. It may be glutens, you may not know it. It may be sugar, you may not know it. But if you don't feel well, start taking some things away that you would not necessarily associate with migraine headaches, upset stomachs, whatever it is. You might be shocked. I've got a patient that's had migraines her whole life. She started this virgin diet where it's an elimination diet. Came off everything, started reintroducing things, and the one thing she was allergic to, tomatoes. You know, why would a tomato cause a migraine headache? I don't know that anybody knows, but the bottom line is she stopped eating tomatoes, and she feels a lot better. We were talking earlier about stress and anxiety. Sometimes certain types of foods can cause stress and anxiety because the body just doesn't like what you're sticking into it. And I would assume it's very much like, what happens when you're doing computer work and you're trying to hack into somebody's system and it's just not working properly, and just things aren't working well. So step back and see if you can find something else. And again, I really wish I would have been here yesterday for the Bowen demonstration, because that sounds like something else we could use to help us feel a little bit better. Now I'm just going to talk just a little bit about acupuncture. Not a lot of people know about it. They've heard about it. It's only been around for like 3,000 or 4,000 years or something like that. Bottom line is it works. What we're showing now is we have some true proof that acupuncture really does work. It increases the serotonin levels, decreases cortisol levels. We can actually show tests that prove that. But some of the great things, some computer use, which is really wonderful. Now they're using functional MRIs to actually show how the brain lights up in certain areas where we can say, hey, we stick a needle here, it stimulates this part of the brain. Now we can actually prove it using functional MRIs. And again, I found that one study was really amazing. A physicist in California had fallen, hurt his back. He went to this Chinese doctor. The guy sticks needles in his back. He feels better. He's like, I don't know how it works. I want to know. So he started this research, and using functional MRIs, he found out that sticking a needle in bladder 67 stimulates the visual cortex of the brain, posterior aspect of the brain. And the way they did this was using a functional MRI. They scanned his head. Then they showed him a bright light and scanned it again, and it stimulated the visual cortex. Then they stuck a needle in bladder 67, which is the outer part of the small toe, if you just right beside the nail bed, and I can promise you that does not feel real good, but it stimulates the visual cortex of the brain. So people ask me, well, how do you treat visual issues? I treat double vision, like diplopia. I've got a couple of people with a vertical diplopia, which is very strange. But a couple of the points I use are bladder 67. You stick these needles in the outside of the small toe, and if you do it right, they only scream a little bit. Of course, if you gag them, then they don't scream at all, which is what I like to do. Gallbladder 34. And again, you're not going to be tested on these later. It's on the outside of the lower leg, just below the knee. Stimulates parts of the brain. We can actually prove this using these functional MRIs. That's why people that see me do better when I use the acupuncture, no herbs or anything. For Parkinson's and movement disorders, it stimulates the dopamine. It's very, it helps with the movement disorders. It doesn't stimulate the dopamine as much as serotonin, but the bottom line is it helps. Liver 3 affects parts of the brain related to stress and vision. That point right there, liver 3, I bet you I could walk around here right now and poke every one of you on that spot. It's between the webbing of the first and second toes, and you will probably not say very nice things to me. But if I can get a needle in there without you screaming, you'll love me. It absolutely lowers stress and anxiety. It's an absolutely wonderful point. And then kidney 3, which is on the inside of the lower leg, stimulates the parts of the brain, stimulates the kidneys and adrenals. It's really, and again, the great thing about science now, we have all these wonderful computers and all this wonderful technology. We can really, truly measure these things. A couple other things I want to talk about really quickly, and then I'll quit yakking, and if we have any kind of cool questions, we can get to those. But some new advancements in medicine. Now, I'm getting ready to screw this up, I'm afraid. These PRP injections, one kind of a neat thing, because I do pain medicine, is we're trying to find other ways to do things without introducing new medications, because, again, some of the people that come into our office have lists that you cannot imagine. You can imagine, but I don't know if everybody else can imagine. I mean, you're talking 20, 25, 30 different medications. They're taking all this shit that's making them worse, and they can't figure out why they feel so bad. Well, we got a pretty good idea. But anyway, this PRP, what they're doing is they're centrifusing some of your own blood, and they're reintroducing it to joints. Now, there's some different kind of research being done on this. I've seen patients that have done really well with it in their elbows and their knees, and I've seen people that didn't do so well. But the kind of cool one is they're getting some nice early results in these intravertebral disc injections. So, and I'm sure everyone in here knows or has seen, people with lumbar spine fusions, cervical spine fusions. The problem with those is once you've done one, you're going to get another one done. And then you're going to get another one done, because as you start fusing these should-be moving parts, the parts above them, those start to break. And it's just it's a really difficult cycle. And if people jump into it too quickly, it really becomes quite a mess. We see a lot of people with these post-laminectomy and syndromes and these, post-surgery or fusion issues. But anyway, they're showing some great stuff with these PRP treatments. But what they've shown is that if you don't do these under guided imagery, in other words, you have to have a fluoroscope, an X-ray, to make sure that it gets into the joint space, it doesn't do any good. In other words, if you go to somebody and you give them $1,000 and they stick it in there in the office and they're not using any kind of guided imagery, they're probably not going to hit the joint space. Probably. For IM injections, like people tear hamstrings, you might have seen if you watch any professional baseball or professional football games, they're doing these a lot for the athletes. Of course, I guess if you make $3 or $4 million a year playing a sport, you can probably get anything you want. I don't have that issue. Frequency medicine. This you guys may or may not know anything about. I know one person does. Frequency medicine is something that a lot of people are not familiar with, but is absolutely incredible. Back in the early 1900s, this physicist named Dr. Royal Rife did this. And my understanding is that he was asked to do this by the German government, and they hypothesized that you could hold a cylinder, run a current through it, measure it, and figure out what's wrong with somebody. And that's how this all started. Rife did the research. Dr. Hulda Clark, who's now deceased, also did the research. But what they did was they take, and I don't know if, like I said, if any of you guys know anything about it all, I'll make it quick, but they just shot little cells through people, through the cells, frequencies through cells, and measured the frequencies. They found out which ones lyse the cell. They found out which ones don't do anything for the cell. They're showing some terrific results on these right now with these really crappy brain tumors called glioblastomas. I use frequency medicines for everything. I've got a guy that was sent to me. He'd seen 7 different doctors. He had had a TURP procedure. Anybody familiar with TURP procedures? Yeah. One, transurethral. So what they did is the guy had a prostate issue. They went in with a rotor-rooter and kind of rotor-rooted it out. When they pulled it out, they dinged a nerve. So the guy comes into my clinic like this, crying. He'd just been kicked out of the emergency department. Like, what do? I put the frequency, thankfully. I didn't have to use any needles on this little pee-pee. I assume it's a little. I don't know. But anyway, I put this frequency unit on him. I ran this frequency through him for urethral inflammation, and he got better. Now, this had been going on for 2 months. The guy was miserable. He was suicidal. His wife's like, you got to do something. He's going to kill himself, literally. It works really well. I had another lady, sadly, she had a vaginal shingles, and that is not your friend. nobody could do anything for her. I put this frequency machine on her. We ran a frequency for the shingles virus, and she got better. Now, and everybody was amazed. They're like, that's, the bottom line is frequency medicine works if you use it right, but the bottom line is we have to all make sure that we get things worked up appropriately and then check out all your options. And we talk about that a lot on our show. Am I out of time? No. Oh, we're good. I left my phone. I don't know how I am. But really quickly, the last slide, computer technology, it just gets better and better. And the more we on the front line taking care of sick people have people on the backside driving the research and telling us what we can do and helping us do our jobs better. You just cannot imagine how much it helps us. When I was in school, it was in the late 90s. It was, chemo was huge. We were just starting to get into a lot of other things. Chinese medicine was not so big. Now it's becoming more and more mainstream. People are starting to realize the benefits of herbs and using those herbs and using alternative therapies like the Bowen therapies and the acupunctures and the chiropractics and stuff. When used properly, all those can be absolutely terrific. And then finally, if you have medical questions that you can't get your medical provider to answer, you can always email me at sfitz@nervanah.com. My little Simply Herbals medicines again that I set out there on the desk when you came in. Please feel free to grab those. They're really truly wonderful herbs. They're healthy, and they probably should have been passed out many years ago. But thankfully they're getting out now, and I'm working on getting them all over the U.S. and the world. So, like I said, now. I tried to blow through this because it's right after lunch. There's actually some interesting stuff coming up after me, like the lock-picking guys. So if anybody has any questions or anything, yes, sir?
Well, I wanted to guide a little bit of conversation because, you mentioned the show that you guys do and the podcast and things like that. But one of the things we were talking about before, and I'm kind of curious, you mentioned like complementary medicine.
Right.
And I guess that certain... It's interesting because in certain areas of the country, there's a shift back to complementary care and focuses on certain health providers and like having the trusted practitioner, but
right.
that works with other types of providers to provide a better quality of care. And obviously, some of this is changing with some of the healthcare stuff that's going on and all that type of stuff.
Yes.
I mean, how much is that helpful to getting access to these types of treatments and things like that? Or
it is, and I think a lot of the healthcare providers, so the Blue Cross Blue Shield, Cignas, those guys are starting to allow people some more freedom with their money, giving them money that they can actually spend on other things that might help them. Again, I really hate to miss that Bowen technique, but that is something where patients can now, instead of going in and getting an x-ray on a knee that's going to cost them $1,000, or going to physical therapy because their doctor says, oh, you just need physical therapy. They can do some other things with that money. They don't have to spend $285 every time they walk into that physical therapy office. And maybe they can go get some acupuncture. Maybe they can go have a Bowen technique or a massage. And that's one thing. And I don't like to talk about this whole healthcare thing to a lot of people because it can be really inflammatory and divisive because of people's affiliations or whatever. But the truth of the matter is, the good news is at least there's some dialogue now. The providers are getting killed right now from reimbursement because insurance companies aren't wanting to pay, and they're raising premiums on the patients. So patients aren't wanting to come in and see doctors. And I don't know how many of you guys have health care or don't have health care, but one thing we saw for the first 6 months of this year was a significant drop. And you guys, I don't know if you saw it in Cookville or not, but we saw a significant drop of patients coming in for regular health care, checkups, everything, because nobody wants to pay the out-of-pocket money, especially if they've got a family of four and they've got a deductible of $2,500 or $5,000. So what they're doing is they're starting to use other things, but the problem with using other things like your like acupuncture or a traditional Chinese medicine doctor, which is what I am. You really have to have Western medicine backing you up, doing these exams, doing these scans, making sure that things that need to be treated can be treated, and if not, finding a better way. But I think you're going to see a big transition in the next couple of years, and certainly depending on who the next president is, it's really going to affect a lot of things. But the best part is if you are employed, which some of us here are and some of us aren't, and you do have health insurance, you can call your providers and say, look, I'd like to consider doing this instead of just getting more Lortab for my back, because the Lortab is not making me better. So yeah, so it's I think we're going the right way. I think it's just really painful.
So, and if anybody has any questions, oh, do I have both of them here? So I'll. Any questions, real quick? Okay. I was going to say I have other ones, but I don't want to hog the microphone.
Is this thing on?
It depends.
Where's the best place to find the herbs?
Right. Now that's a huge that's that question is very important, because I would tell you to kind of stay away from the big box stores. And I'm not saying all the big box stores are bad, but it's ideal if you can find a provider that actually has them in their clinic. They've usually been vetted. My clinic, I have every kind of herb imaginable that I trust. Vitamins are kind of the same. Some of the companies, the big people like online, like Amazon, Vitacost, those guys do carry a lot of really good stuff. But just make sure that you do your research, and the bottom line is you can't go down here to Walmart. No knock on Walmart, but you can't go to Walmart and buy a $5 bottle of herbs and expect something good. Because they've not necessarily been cleared out. Now, and the other thing I would warn people and caution people against, don't, going to a GNC, no knock on GNC, but going into a GNC and saying, well, I've got insomnia, because now this is a question I get a lot. I've got insomnia, so they go into GNC and they give them something to make them sleep. That person in there is not medically trained and may not know why that person is having insomnia. There may be a medical reason why they're not sleeping, and that's what we were supposed to be able to diagnose and treat. So what I would say is, don't spend a lot of money initially. Don't go buy a $120 bottle of pills and have to sign up for this recurring monthly shipment that you probably are not going to need. So find somebody reputable online. You can always email me, and I'll say, hey, look, and because I have people all over, and I do the best I can, but I've got a guy in California right now that's just a train wreck, and he'll send me an email every once in a while. He's really good about not wearing us out, but and I've turned him on to the right resources in California where he can get his herbs. The guy's doing better. He's an over-the-road truck driver, and he can't take narcotics, and he can't take this, and he can't take that. So I've helped him get some stuff. But now my herbs I get from Golden Flower Chinese herbs. They're at Albuquerque. I've got all of the science and technology saying that they're completely natural. There's no chemicals. There's no anything in them, and that's we take a lot of pride in that. So that's an excellent question. I appreciate that. Yeah.
Yeah. So you brought up a couple of things, I guess, and I'm trying to think. Like a lot of us computer guys and things like that, things for concentration, or there are a lot of different conditions that are very typical for computer professionals or people in technology professions and things like that. So issues with like focus or attention span issues or those types of things. What types of treatments could they ask their professionals about that might help them with some of those things? Because, I mean, in most instances, and it's something that's very common and something that in a lot of areas can be overly abused, are some of these, like you mentioned, narcotics and other controlled substances.
Adderall.
Yeah, I mean, that granted, it has some medical value from our perspective, but one of the things that I kind of heard, I guess the other half of that is that we often want a immediate response to some
Right.
of our ailments, and sometimes it involves more than just popping a pill, but actually involves being proactive, I guess.
Right, right. Yeah, and that's very true. The whole thing with our society today is instant gratification, and that's what we have to balance every time somebody walks in our doors. Is they want something now, so we have to give them something now, and that's a big issue with children and antibiotics for viral infections. The parent comes in, they want something, so they have to give them something. So what I would say is that for computer engineers or hackers or whatever, like I said, I don't want to offend anybody and have them, getting into my bank account before I get home. But there's a couple things. Number one, the stuff that I have out here and I brought today is samples. The Stress Less for stress and anxiety. I'm telling you, you can't beat it. There's nothing like it. A substitute for Adderall. Because a lot of people don't understand how addictive, highly addictive, and potentially dangerous Adderall can be. That astragalus, the ginseng, they can be used really appropriately and really safe. I've got those in that fatigue reprieve out there. I'm not a huge fan of copious amounts of caffeine, because if you drink caffeine all day long, what it does is it continues to keep the cortisol levels really high and causes inflammation. So that's why I don't have any problem with people having coffee and tea in the morning, getting things going. But as the day goes on, there needs to be other things, and the astragalus and the ginseng are two of the top things. And something else too, I would caution people: there has to be a multi-level, kind of level approach. When you go in, we need to get you on something now to make you feel a little bit better. We need to have a short-term approach and a long-term approach. Long-term approach, one thing I love more than anything in this world is yoga. I do a lot of yoga, and not in my house. I go to a class, I make myself get out of my hole, my dungeon at home, because I much prefer to be in my little cave, right?
That's why we
go
have to
to
keep the
class.
lights dim in here for these guys.
Exactly. It's much more comfortable. But that's what I do. So I make myself get out and I make myself do yoga. Yoga is an absolutely wonderful thing. I'm going to look more at the Bowen technique because it looks pretty promising and kind of intriguing. But those things really go a long way for balancing anxiety, for balancing inflammation, for just making people feel better. And unfortunately, when people have inflammation from sitting and pain from sitting, right, because you sit all day long and you have all these weird things. We don't need that. The hardest thing to do is to get people moving because they don't feel well. Yeah.
Just turn the projector off.
So inflammation. And people that don't feel well, it's really difficult to get people to move when they don't feel well. And I think some of the worst advice we can give patients is when they come in and they say, well, I'm depressed. Well, get out and do something and you'll feel better. That's a really bad answer. Well, I need to lose some weight. Well, exercise. Well, you can't always exercise if you feel crappy. How are you going to go exercise if you've got gout in your ankle? You don't. It's not that easy. So that's why it's important to have a multi-layered, multi-tiered approach to health. And sometimes a pill is a great thing. It really is. It certainly is. I've gotten gout in my leg before, and I'm telling you, I would have shot anybody in this room for something for my gout. And that's a true story. And there's no herb that fixes my gout. I've tried them all. So, yes. So there's a lot of really, there are some medicines that really do need to be used. So, yeah. Anything else, guys? Anything? Any other questions? Like I said, if you got anything that's a little more personal, poo questions,
really share.
penis questions, things like that, you can always email them to me. Because that's what it is. Everybody wants to talk about poo and penises.
Yeah,
I'm
we'll
not
turn
real
the
sure
camera
what it
around
is.
and you can
Yeah,
ask your questions. And
everybody close your eyes. Don't, because the guy in the back raising his hands is, how come my tummy hurts? So anyway, but guys, I really appreciate you having me here. I hope I didn't bore you to death. And they were giving me a hard time. They said it's a little bit of a stretch hacking the body, but thankfully I had a teammate here that was hacking the body first using some stuff. So it's been I've enjoyed this. It's been a wonderful experience. So thank you.